right, we are on part 2 of our lecture on the cardiovascular system and looking through the blood flow. When we look at the heart, there's 2 different circuits essentially that the heart pumps blood to. It pumps blood to the pulmonary circuit, which describes the vessels that go from the heart to the lungs and back to the heart again. So that's a pretty short circuit. It's a low pressure circuit because the distance of the lungs from the heart is pretty small. And the systemic circuit describes the vessels that go from the heart to all the tissues of the body, all the organs of the body, and back again. So that's a much longer circuit, and it's under much higher pressure because our vessels leading to all of our organs can sometimes be constricted due to plaques as a result of smoking and high cholesterol, or just chronic constriction, which happens with smokers, and the effects of nicotine on the body. So the systemic circuit is a higher pressure, longer distance circuit compared to the pulmonary circuit. So looking at the circuit then, we can see that the pulmonary circuit is this shorter circuit here going to and from the lungs. So it starts with the right side of the heart. The right ventricle pumps blood to the pulmonary arteries, because remember, arteries lead away from the heart, so it pumps deoxygenated blood from the pulmonary artery into the capillaries of the lungs, where it drops off carbon dioxide and picks up oxygen. And then the 4 pulmonary veins, there's only one shown in this diagram for simplicity, but there's actually 4. So 4 pulmonary veins lead back to the left atrium. And remember, veins bring blood back to the heart. So these are pulmonary veins bringing blood to the heart. And then that blood enters the left ventricle. The left ventricle, well, basically that completes the pulmonary circuit then. So we are receiving blood into the right atrium. The right ventricle pumps it to the lungs. And then the pulmonary veins bring it back to the left atrium and down to the left ventricle. And notice that the vessel has changed to a red color, indicating that oxygen is now in this blood and it's ready to be pumped to the rest of the body. So the left ventricle then pumps to the systemic circuit. So we can see it pumps out via the aorta, and the aorta branches upward via the carotid arteries to the head and the brain. And then the thoracic aorta and the abdominal aorta descends downward and feeds all the tissues of the body. So the systemic circuit contains the aorta and all of its branches. The pulmonary circuit is made up of the pulmonary artery and the pulmonary vein. So what brings blood back from the systemic circuit then is the inferior vena cava in the lower part of the body, and then the head and neck is the superior vena cava. So the vena cava bring blood back from the systemic circuit, and the pulmonary vein brings blood back from the pulmonary circuit. So again, the systemic circuit is quite extensive. So this is a high pressure circuit, and when we look at heart failure, it's often the left ventricle that fails first and is not able to pump blood efficiently because of pushing blood under such high pressure. Again, especially in those that have chronic hypertension, which is that systolic blood pressure that's greater than 139. And a common cause of hypertension, what some people know, is sleep apnea. There's a lot of people out there that have sleep apnea that don't wear their CPAP machines because they're not comfortable, or they're just kind of a nuisance, or maybe they don't have good insurance and they haven't arranged to get one, or maybe just haven't been to the doctor to assess their sleep apnea. But people with chronic snoring should always be assessed for sleep apnea because it can lead to chronic hypertension and eventually heart failure on the left side of that heart. I've had patients that I've taken care of that are in their early 30s that are already suffering the effects of heart failure, where their legs fill with fluid and their lungs fill with fluid, and they'll be hospitalized for a period of time to get off that excess fluid. And once the heart fails, we can't really bring it back to normal functioning again. So it's really important that we take sleep apnea very seriously. And if you or someone you know snores loudly at night, they should be evaluated for sleep apnea by having a sleep study done to see if they would be benefited from that CPAP machine. So again, looking at the different circuits, it's important to understand that the pulmonary circuit is just to and from the lungs, and the systemic circuit is going to and from the rest of the body. So the pulmonary circuit is deoxygenated, and it leads to the lungs where gas exchange occurs. We have 4 pulmonary veins that bring blood back to the heart that is freshly oxygenated. And again, we have those 2 pulmonary arteries carrying oxygen-poor blood away from the heart to the lungs to pick up oxygen. And the systemic branch is made up of the aorta and all of its branches. So the key word here is the aorta. And the vena cava bring it back to the right atrium to pick up, that oxygen from the lungs through the pulmonary circuit. So the aorta carries blood to the systemic circuit, and the vena cava, the superior and inferior vena cava, bring blood back from the systemic circuit. So looking at diseases that affect the cardiovascular system, we already talked about hypertension. It's a very serious condition, again, that can lead to heart failure if it's not treated with medications. And often people are on medications that are not effective anymore. So blood pressure needs to be constantly monitored, and people need to make sure that their medicines are working. And not to go off their medicines because their blood pressure is normal again. Because when the medicines are working, then we're going to see a return to normal blood pressures. That's not an indication to stop taking those medicines, and that's a big mistake patients make. And oftentimes we see patients on the floor I work on, because it's a cardiopulmonary floor, we see patients that come in with really high blood pressures. The systolic blood pressures will be in the 200s, and it's because they stop taking their blood pressure medication. What happens when patients do that is they get something called rebound hypertension, and the body responds from going with normal blood pressures with that medication. When that medication is discontinued by the patient, they get sky high blood pressures, and then it takes a lot to bring that down again. So it's really, really important that people not forget to take their blood pressure medicine, and that they're checking it at home to make sure that it's still working. So atherosclerosis is hardening of the arteries, and it's often due to a buildup of cholesterol from a poor diet, sedentary lifestyle, and smoking. Smoking is a lead cause of hardening of the arteries and cholesterol, plaque buildup in the arteries. And because of that plaque buildup leads to inflammation and damage to the vessels, and often causes, like I said, this inflammation and damage, and often leads to a formation of a blood clot in that area, in those areas of where the damage to those blood vessels is occurring. And then depending where that clot gets stuck, if it gets stuck in the brain, in an artery leading to the brain, that's what we call a stroke. Or if it gets stuck in a coronary artery that supplies the heart muscle, that's what leads to heart attack. Or sometimes we have what's called an aneurysm, and that's a weakening of a blood vessel. Again, that is it. Aneurysms are more common among smokers and also among people who are heavy drinkers. So that's a weakening of arteries, and because of the high pressure that arteries undergo, because of the contracting of that left ventricle, and the right ventricle as well, but the left has higher pressure, we already talked about. That can cause a weakening of a blood vessel and cause a blowout in that vessel, which would lead to severe internal bleeding, and the risk of death is much higher for an aneurysm because of the amount of blood loss that we see in the major arteries. For example, the abdominal aorta is sometimes a common vessel that weakens over a lifetime of smoking and drinking, or drinking, one or the other, and both. And then when that large vessel in the abdomen bursts or has a small hole, there's a lot of blood that leaks out. Blood pressure drops very quickly, and the person will die if that is not treated very quickly. So hypertension is called the silent killer because oftentimes people walk around with high blood pressures and they're not really aware of it. Sometimes I can see high blood pressure in an individual when they have that kind of flushed look to their cheeks. They'll get like a real dark red flushed look to the cheeks and to the nose. That's often a sign a person is walking around with high blood pressure. That's not to be confused with a skin condition called rosacea. That's different. That's just a difference in the capillary dilation and serving the skin. But chronic hypertension causes a flushing sensation in the skin. It can also cause headache. It can cause a feeling of fullness in the head and neck, and definitely needs to be treated because when that left ventricle is pumping blood under high pressure, 140 or greater, that causes the heart muscle to eventually weaken and fail. And again, that's a permanent lifelong condition that's going to require a lot of medical management, and it's going to decrease the quality of life. So really, really important that we pay attention to the blood pressure and treat it as necessary. Oftentimes we treat it with diuretics. A diuretic is a medicine that causes us to make more urine. So when we urinate more fluid out of our bodies, that decreases the amount of fluid in our blood vessels, and that's going to decrease pressure. So that's a very common treatment. Sometimes we'll give patients a medicine that not only opens up the vessels or what should I say, lowers the heart rate a bit to put less stress on the heart, but we'll also give them a diuretic as well. And a common name for a diuretic we give patients is called Lasix or furosemide, or another common one is hydrochlorothiazide. So we'll give patients those diuretics to just decrease the fluid load in their body. And we'll also ask patients to be careful about the fluid that they bring into their body if they have heart failure, because it just causes more volume in the blood vessels, and the heart has to work harder as a result of that. We talked about atherosclerosis already. That's just a narrowing in that blood vessel diameter due to a buildup of this plaque in the wall of the vessel. A thrombus is a clot that forms in that area, that damaged area of the vessel, and it stays there, but it impairs blood flow. So as a result of that, sometimes we see that in the limbs, like in the leg or the arm. People will get a thrombus, and all of a sudden they notice that their arm or leg feels really cold and aches because there's impaired blood flow. So we need to definitely take care of that. Sometimes a blood clot will break free from an area. Say someone had surgery and a blood clot forms and it enters into the general bloodstreams and gets caught in another area. For example, in the lungs. It's not uncommon for people to come in after surgery or an injury and end up with blood clots in their lungs. We call those pulmonary embolisms or pulmonary emboli is the correct English way to say that. But that is a clot that was formed somewhere else but traveled to the lungs. So that causes difficulty in breathing and will often require hospitalization if it's severe. And a thromboembolism is an embolism that is caught in a vessel, but it kind of gets stuck there. So again, like a pulmonary embolism, we use those terms interchangeably. It traveled to a distant site, but it's stuck there. So that is an example of a thromboembolism. So the example I gave of a person having surgery and getting a blood clot to the lung, that would be an example of a thromboembolism if it gets stuck there in that lung and impairs blood flow. So it's important that we treat those conditions carefully, and that patients who've had surgery, when they go home on a blood thinner, or if they have a condition called atrial fibrillation where the atria aren't contracting forcefully enough to empty the atria and blood starts to pool in the atria of the heart, it's important those patients with atrial fibrillation take their blood thinning medicine, because it puts them at risk for blood clots forming in those atria and traveling to other parts of the body, leading to heart attack or stroke. Stroke is most common. So here's just an example of what a clot looks like. It's made up of high cholesterol and fat, and there's damage then to the blood vessel wall. It narrows, it's not as large for blood flow to go through easily, and as a result of that, we start to see damage. Here's an ulceration, and then that causes a blood clot as those red blood cells then start to stick to and become damaged as a result of that plaque on the wall of that artery. So this is what we commonly see in patients who have high cholesterol in general. They tend to have their coronary arteries, one or more, will start to narrow because of these plaques. Stroke, we already talked about, is when an artery serving the brain is blocked, or if it weakens and bursts, that's a hemorrhagic stroke. The issue with this is that the brain will die very quickly without that oxygen, so it needs to be, repaired quickly, just like the heart as well. But when people start to have a stroke, they start to have some symptoms of impaired speech, slurred speech. One side of the face will droop. They'll have difficulty lifting their arms equally, so you can ask a person to hold their arms out in front of them, and if one arm drifts downward, that's often a sign of a stroke. So it's important to be aware of the symptoms of a stroke and act very quickly to get them help, because if we can give them a medicine that will break down that clot, if we can get that to them within 2 hours of symptoms, sometimes we can reverse the stroke and there'll be no permanent damage. So it's really important that they seek medical care very quickly if they show any signs of a stroke. The interesting thing is migraines can sometimes mimic signs of a stroke. So patients will come in, or people will come into the ER with symptoms of a stroke when it's actually a migraine. But doctors and clinical, practitioners would much rather tell somebody it's just a migraine than have someone stay home and have a stroke and suffer permanent effects from that. So it's never a bad idea to go in and be evaluated anytime there are symptoms that hint of a stroke. Heart attack, another name for heart attack is myocardial infarction. So myo means muscle, and cardial, we know, refers to heart. So myocardial infarction is a heart attack, and it occurs when there is a blockage in a coronary artery that is supposed to supply fresh oxygen to that heart muscle. So what can happen if it's partially blocked and there's a little bit of blood flow, the heart muscle will not be able to provide enough energy for full function, so it'll start releasing lactic acid as it has to switch to a different form of energy generation, and that leads to a burning sensation or a pressure sensation in the chest. It can also travel up the neck, it can travel over to the shoulder on the left side and down the arm. That's called referred pain. And sometimes, people have unusual symptoms that are a heart attack. Some people don't have any chest pain at all, but they have feelings of weakness, shortness of breath, and nausea and vomiting and sweating. So it's important, if there's any unusual symptoms not typical of a flu or a cold, that again, that be evaluated, especially in patients that have high cholesterol and are at risk for heart attack because they have some of those factors such as hypertension, high cholesterol, obesity. Those are all, risk factors for heart attack. And smoking, of course, is another risk factor because it increases the risk of high cholesterol and plaque buildup, as well as it narrows the arteries. The minute a person takes nicotine into their body with a cigarette, whether it's an e-cigarette or a regular cigarette or chewing tobacco, nicotine constricts blood vessels and will increase blood pressure as long as nicotine is in the system. So for people that are smoking all day, every day, or chewing tobacco all day, every day, that is constricting their blood vessels and causing their heart to work harder. So that's why we always recommend patients deal with their nicotine addictions, and if they're going to do any positive health decision for themselves, let's say they have a number of health issues, quitting smoking is number one. So an aneurysm, we said, is a weakening of the blood vessel, and obviously if you have high blood pressure and these plaques on the blood vessel wall, that can weaken that vessel, cause it to balloon out with the pressure built by the left ventricle pumping the blood. It'll eventually rupture and the person will bleed out. So when we have clogged arteries, common extreme treatment is coronary bypass. So that's where we will go into the heart and bypass that clogged vessel by taking a vessel from the leg, typically from the branches of the great saphenous vein. We'll go in there and take little pieces there and bypass the vessel that is damaged. And that requires, an incision down the sternum and, a hospital stay of at least 3 days, up to a week or more, depending on how well they recover. Sometimes we can give people gene therapy. That's not a common treatment, but sometimes they can grow new vessels around the damaged vessel. And angioplasty is a first attempt. If we can go in and do a heart catheterization to go and look at the vessels that lie over the heart, and if we can apply a little stent inside there, it's like a mesh cylinder that goes inside the vessel, and it kind of squeezes and pushes the plaque to the edges and opens up that vessel. They're coated with a blood thinner, and the patient will also take a blood thinner medicine every day. That can sometimes open up the vessel and avoid coronary bypass surgery or bypass. And I'm going to show some videos on each of these, the coronary bypass, the angioplasty, so you get a good understanding of what that procedure is. So this is an example, just a still picture of what bypass looks like. So they take branches, so that if the clogged vessel is here, what they're going to do is take a vein from another part of the body, connect it on the, beyond the damaged area and connect that right to the aorta. So as the aorta receives freshly oxygenated blood from the left ventricle, that freshly oxygenated blood will leave the aorta and enter this bypass vessel to serve the heart muscle. So here we can see this would be called a triple bypass because we have created 3 bypass vessels over this heart. Maybe you've seen or heard of quadruple bypass, double bypass, single bypass. Just depends on how many vessels we need to bypass. So this is an example of that. And then a stent is when one of these vessels, again, is clogged, but it's not completely clogged. Sometimes if they're so clogged and so narrowed, we have to do bypass. But if there's just a minor narrowing, just a little bit of cholesterol buildup, we can insert with a catheter, that's what the blue thing is here, we can insert a stent, which is this mesh cylinder, and that will expand. We use a balloon to expand it and push that plaque to the sides, and then we leave that mesh cylinder in place to keep blood flowing through and preventing that vessel from narrowing again. So sometimes this is all a patient will ever need in a lifetime. Other times they might need more stents, and sometimes if the narrowing continues beyond what can be treated with a stent, then they're going to go for bypass surgery. So again, we talked about heart failure a little bit. That's when the heart cannot pump anymore. It just is a result of the inability of that conduction system to tell the ventricles when to beat as a result of the SA node firing correctly, or it might be the result of chronic hypertension and the heart muscle cells simply fail. So a couple of things we can do is give someone a defibrillator that is implanted into their chest wall and that has leads to the heart, and it stimulates the heart to beat at a regular rate. Sometimes heart transplant is the only option. Sometimes we can inject stem cells to repair the damaged part of the heart. That is not a common treatment. That's kind of a innovative up-and-coming treatment. Some people have a special device called the LVAD, and that is a battery-powered pump that wraps around the heart and pretty much contracts for the heart muscle. And then an artificial heart can be used for people who have complete heart failure and are on the transplant list waiting for a real heart from a donor. So here's an example of what an artificial heart looks like. So here we can see we have the action of the ventricles here. It's pretty cool, and the major vessels that are going to pump to the rest of the body. So it's just a temporary solution, but it's pretty amazing that we've been able to actually, remove a diseased heart and replace it with an artificial one and keep that patient alive. So I have an animation here of the pulmonary and systemic circuits. What I would recommend at this point is to go into our Blackboard folder for the cardiovascular lecture, and there are some handouts that I gave you for labeling. So I would print this picture out. There's a picture just like this in those handouts. I would print that off and label as you watched, adding the arrows. And I think you'll find that really helpful on the lecture quiz and the homework on the pulmonary and systemic circulations.
The cardiovascular system is divided into systemic and pulmonary parts. The systemic circulation carries blood from the heart to tissues of the body and then returns it to the heart. Oxygen-rich blood is pumped from the left ventricle into the ascending aorta. The aorta then makes an inverted U-turn to form the aortic arch, which gives rise to branches that supply the head, neck, and upper limbs. The aorta continues posterior to the heart as the descending aorta, which travels through the thoracic and abdominal pelvic cavities. It supplies the organs of these cavities and the lower limbs. In the systemic capillaries, oxygen is exchanged for carbon dioxide, resulting in oxygen-poor blood. The oxygen-poor blood enters the right atrium via the superior and inferior venae cavae. The pulmonary circulation carries blood from the heart to the lungs for gas exchange and then returns it to the heart. Oxygen-poor blood is pumped from the right ventricle into the pulmonary trunk. The large pulmonary trunk divides into the right and left pulmonary arteries. These arteries transport blood to the right and left lungs. In pulmonary capillaries, carbon dioxide is exchanged for oxygen. This results in oxygen-rich blood that then flows through the 4 pulmonary veins and enters the left atrium.
Looking at the functions of blood, we'll pick up with this topic in our next lecture video.